I'm giving you the station and you can take as many minutes as you want to read and prepare. And yes, there are two slides, this one and another one. Once you're done reading this one, you can ask me, I'll change the slide.
Okay. Okay, we can go to the other slide.
Okay.
Okay, we can start.
All right. So if you have read and understood, considering it communication skills station, kindly please begin.
Hello, I'm Dr. Mahir, one of the ST1 resident. I'm calling to speak to the cardiothoracic consultant to accept a referral about a patient with widened mediastinum. Can I confirm that I'm speaking to the right person?
Yes, please proceed.
Yeah, we have one patient, a 32-year-old motorcycle, presented drowsy. He's non patient of DM. Um, he has raised chest pain. His GCS was 14, his heart rate 120, and his blood pressure 100/80, temperature 37. He have left thigh swollen on examination, but no open wound. Possibly on examination was fractured. His hemoglobin was 8. His fasting blood glucose was normal. Urea creatinine, LFT was normal. CRP was minimally raised. His ABG pH 7.2. PO2. His his pH 7.32. His PO2 10 kPa, and his PCO2 6. His bicarbonate is 19. We did chest X-ray which show wider mediastinum, and abdominal X-ray also showed psoas shadow obliteration, and there is also small bowel dilated loops. We have done left femur X-ray which show fracture, and our CT is not available for the next 3 days due to services. So I'm calling you to accept this patient because we suspect that this is a widened mediastinum, and we suspect that this patient is having aortic dissection, traumatic aortic dissection.
Okay, doctor, can you tell me what will you do for the cervical spine?
Yeah, we will do full cervical spine fixation using hard neck cooler, and sandy bag with tape fixed to it.
And what about the leg? You told me that the leg is swollen. Do you have done X-ray?
Yeah, we have done X-ray, which showed a fracture of the left femur.
So what will you do for this?
I will make sure that the patient is on Thomas splint.
Okay. And what about blood pressure? How you are managing his blood pressure?
Yeah, we are resuscitating the patient with balanced resuscitation, so that we fear he may have dislodged hematoma. So we give him careful resuscitation, and also we prepare 4 units of blood, which is ready on need.
Okay.
Yeah.
You told me that you have done ABGs and it shows the pH is 7.32. What it signifies, and why this is why there is this acidosis?
Well, this patient, ABG, this acidosis could be caused by his shock and hypovolemic shock, and also could be caused by his limb ischemia, which could be this compartment syndrome at the meantime, and also as he having this closed fracture. And also this patient is diabetic, so possibly this could be caused by DKA.
And what about abdomen? You have done
What's
X-ray
that?
and it shows absence of SWAS shadow. What does it signify?
Yeah, this absence shows schedule is also signifying that maybe there is intra-abdominal collection, meaning there is intraperitoneal hemorrhage. For the meantime, the patient we are assessing him for any deterioration in his abdominal assessment. So maybe he need also laparotomy.
Okay, and who will
If
come with the patient to the to our setup or to our hospital?
I will speak to the ITU and ICU on call.
Yes.
So
Okay.
I'll try to keep ICU or ITU on call of the patient, in case he may need CPR or intubation.
Okay. Okay, you can send the patient. Okay.
Okay, thank you very much. I will
Yeah.
keep you updated
Welcome.
about the case. Thank you very much.
Okay. Thank you.
Right. You still have 2 minutes.
Okay.
What more could you
And
have told? Yes.
yeah, one thing he didn't told me anything about that they have pleural effusion.
No.
He done anything about pleural effusion or not?
No. This is his
Because
first time he is presenting, so many things he'll
yes,
learn.
yes.
Yeah, of course. Because this patient, we have done this right chest tube incision. It drains 200 ml of blood. We inserted right chest tube, so it's swinging and working now, functioning.
Okay. Thank you. I'll stop this.
Okay.
And then, yes.